the Navy nurse. In this episode, I would like to talk to you about the types of patients that I have been taking care of while I'm working on a med-surg / multi-service ward at the Naval Hospital in Okinawa. Disclaimer, I will not talk about my patients that I'm actively taking care of, and I won't mention names or dates of birth. I don't want to violate any HIPAA rules and regulations, and I don't want to infringe upon any of my patients' privacies. So with that said, I will continue. So in the past few months, so I'll say recently, I've taken care of just a multitude of types of patients. So one thing to understand about working on a multi-service unit is that it's just not one type of patient that you're going to take care of all the time. We get lots of different types of patients. So for example, I took care of postpartum couplets, a few postpartum couplets. So we do have a MIC, or a mother infant care center, on the 3rd floor. I work on the 4th floor. So on the 3rd floor, they take all the mother babies, their labor and delivery and postpartum, but they are busy a lot here in Okinawa. There's a saying that we say here in Okinawa that if you get stationed here, you're gonna have a baby. The reason why is because we have typhoons here, and they say that, you know, when a typhoon is going on, all you do is stay in the home and do you know what, and then 9 months later you have a baby. So that's like kind of the running joke out here, is that if you get stationed out here, you're gonna have a baby. Anyway, so the MIC is full a lot. It's arguably the busiest floor in the entire hospital. So with that said, they get full a lot, so they have to transfer couplets up to us, the multi-service unit, and then we take care of the postpartum couplets. So although it's not my favorite thing to do, I'm not a labor and delivery nurse, I actually do like taking care of the moms and babies, because it's different than taking care of my normal sick type of patient. So when you have the mom and babies, you know, you're getting to take care of the cute little babies and see happiness on the family's faces. So that's cool. It's a nice break from the sick patients that we get. I've also taken care of some neuro cases, so people who have had back surgery. We took care of a Marine officer who was stationed in South Korea, and he traveled to Okinawa to get a posterior nerve root decompression done, because in South Korea, they don't have a neurosurgeon. They don't have the capabilities to perform that type of surgery. So it's cool being out here, because we take care of active duty Marines, sailors, Army soldiers, Air Force personnel, and their families stationed in Okinawa, and also stationed just anywhere around us in the Asian Pacific area. So the Marine officer traveled to us to get the nerve root decompression, and you know, he has to recuperate with us. You know, we have to make sure he's ambulating, that he was able to tolerate a regular diet, that he doesn't have any of the pain or neurological symptoms that he was having before surgery. And then when he's recuperated, then we can coordinate transfer back to South Korea, where his unit is stationed. So took care of him. We had something different, actually. So Okinawa does not have a plastic surgeon. However, we had a plastic surgeon travel to us from San Diego, I believe, just to stay with us a few weeks to perform breast reductions, and also I took care of a tummy tuck too. So in the military, you can get a breast reduction if it's causing you pain, discomfort, things to that such, where it's like changing your life basically, or decreasing your quality of life. So I had never taken care of any post-op breast reductions or tummy tucks. So that was kind of cool. You know, they, with the breast reductions, they come out of surgery with 2 JP drains, and you have to monitor the output and make sure it's not too much output, but also like not too little either. So that was cool, just, you know, taking care of the women who had those breast reductions and the tummy tuck. My favorite, like, of all patient to take care of are just the Marines. They are a different breed of people. They're funny, they're strong, they're like macho. Obviously I'm stereotyping, but more often than not, they're like these, you know, macho Marines that come into the hospital with mostly acute issues. So I took care of a couple Marines that had appendicitis, and then they had to have appendectomies. So took care of them, and just normal post-op things like, you know, making sure their pain is controlled, they're afebrile, they don't have any signs and symptoms of infection, their incisions are healing well, they're ambulating, and after that, you know, they can discharge from the hospital and go back to their units. I also took care of a Marine who had a bike accident and had a really gnarly fall, and had a abrasion on the left side of his leg that ended up turning into cellulitis. So he had to be admitted for IV vancomycin, IV clindamycin, and then we had to just make sure that he wasn't febrile and that he could transition to oral antibiotics and then be discharged home. So those are some types of patients that I've taken care of. We also took care of a 10-year-old who tried to commit suicide. So I won't say how he tried to commit suicide, but because he did, you know, he's a mental health pediatric patient. And here in Okinawa, we don't have behavioral health facilities. So what we do on our unit is we basically are, it's like a holding area until we can coordinate transfer to an inpatient behavioral health facility in the States. So with these types of patients, it's a huge deal. We have to have a one-to-one sit with the patient at all times, 24/7, and have them within arm's reach in a video monitored room close to the nurse's station. We are doing therapeutic communication with these types of patients. We don't have a pediatric mental health ward or unit, but we do have an adult mental health unit. The reason we can't have these pediatric patients go to the adult mental health unit is because it's just inappropriate to have peds and adult together when they have mental health issues. So we take the pediatric types of patients on our floor. So, you know, like I said before, we're doing therapeutic communication with them. We're making sure that they're just not laying in bed, not doing anything all day. You know, we want them up out of bed, making sure they're showering, they're doing activities throughout the day, whether it's a board game or exercises to help them control their anger if they have those types of issues. The mental health corpsmen who work on, and nurses who work on the mental health unit, will come over to our side and help us, you know, do activities with these types of patients, so that they're not just like sitting in a room all day long until they transfer to an inpatient unit stateside. So with these types of patients, they often end up staying with us, sometimes for weeks. We had one that stayed with us for like a little over a month, because there's a lot of coordination that has to happen between our hospital, our unit, our doctors, and the doctors and units and facilities in the States who are going to accept the child into the facility, you know, like the behavioral health center. So these are huge cases that we take care of, and also the families are impacted because the child can't travel alone. So a lot of times, orders are curtailed or cut short, and the active duty service member, the mom or the dad, they have to travel with the patient, and sometimes the orders are just changed too. So it's a huge deal. And that's why there's an overseas screening that you'll have to have done. You and your family will have to have done before you even come out to Okinawa, because there's not a lot of facilities for some types of medical conditions like mental health, or if you have like a child with a cardiac issue or something like that. We don't have a cardiologist out here, so that's why these overseas screenings are super, super important. But sometimes things are acute, or sometimes things happen out here in Okinawa and it's a new issue, and then we just deal with them here, and then we coordinate care to get that patient where he or she needs to go back in the States. So we also have taken care of some like babies, like infants who have had fevers. We did have a baby with cellulitis. I think it just started as a little pimple or scratch, and then babies, their fingernails, they're like scratching, and it made it worse, and the baby got cellulitis. So he had to be treated with IV antibiotics, and we had to make sure he didn't have a fever, and then he could be transitioned to oral, the syrup, and then he can go home. So that's just a few of the types of patients that I've taken care of in the past couple of months. So as you can see, it's just a multitude of different types of patients. It's never the same thing, and honestly, that's what I like about my job. Whenever I go to work, I don't know what I'm gonna get. I'm always learning something new, meeting lots of different people. So it's really cool. I like where I work. I will say too, it can be super, super stressful. I always say there's no easy nursing job. Some days it's really, really busy. You have doctors coming at you. The patients are acting cray-cray. The patients' families are coming at you. Other nurses are coming at you. The corpsmen, the ancillary staff. It's just like everybody is, coming at you at once, and you have a lot of tasks to do. You're trying to critically think on what to do first, what to do next, and it can be really, really fast paced. So some days, I'll come home, my husband and kids will be like, "How was your day?" I'm like, "I don't even want to talk about it. I just want to take a shower and go to sleep. I don't even want to eat anything." So there are days like that, but I will say there is no other job that I would have signed up for in the Navy. Being a nurse in the Navy is super, super awesome. And even though I have stressful days, I still love what I do. So that's all I have for you today. As always, please leave me your questions and your comments down below. I'm happy to answer any questions you have. Some of you have been asking specific types of questions, so if you want to ask that through my email, I'll leave my email link down there. And you can also find me on Instagram at I am Estela Rojas. So thanks for watching, and I'll see you in my next episode.